I grew up in a small town in western Iowa, Templeton, which has about 300 people, and I've actually spent my entire initial training in medical school and residency here at the University of Iowa. My interest in urologic surgery in general comes from the mentors I had here at the university. I worked very extensively with Dr. Williams, who was the chairman here for over 25 years, and spent a lot of time with him. And part of the reason that I decided to go into urology and then specialize in cancer surgery was seeing the relationships he had with his patients. My passion on a day-to-day basis comes from interacting with patients and trying to get them, sort of in normal layman's terms, to understand their disease process. I always try to tell my patients that if I just know what's going on but they don't, that's not enough. One of the important parts of urologic cancers are that there's a number of different treatment options available. So one of the things that interests me is the chance to explain those options to the patient and really let them make the decision and have them have a full understanding of what are the potential benefits of this versus this treatment, and then ultimately what's going to be the best for their decision. The way I try to establish a relationship with the patient, my residents know this, is I want to know where somebody's from and what they do for a living. And so as I grew up in Iowa, you start to get familiar with all these little towns, but I think every day in clinic there's somebody from some small little town that I've never heard of.